In this segment, we're going to demonstrate a muscle energy technique to treat bilateral flexed sacrum. The technique used is a respiratory assist model, and again, the patient presents with pain across the lower lumbosacral angle and as well as in the sacrum and pelvis. They may have what perceived to be clinically a negative standing and seated flexion test, where in actuality it's a bilaterally positive seated flexion test, but they would have bilateral restricted passive sacroiliac joint motion. In the prone position, we would palpate the sacral sulci, and in this case of a bilateral sacral flexion, the patient would have an increase of the lumbosacral angle, and the sacral sulci bilaterally would palpate more anterior or deep, and the ILAs bilaterally would palpate more posterior. So in this case, we would loose pack both SI joints by taking the lower extremity and abducting about 15 degrees and internally rotating the hip. And again, on the other side, we're going to abduct and internally rotate the hip to loose pack both sacroiliac joints. And then we can find the ILAs, and we can take the heel of our hand and make contact with our hypothenar eminence on one side and the thenar eminence the other side. We can reinforce. And again, during the respiratory cycle, when the patient inhales, the sacrum will go into extension or counternutation. So we're going to exaggerate that motion when they inhale. So when the patient takes a slow, deep breath in, we're going to add that anterior force along the ILAs and add a little bit of cephalad pressure and then maintain that during exhalation to resist the nutation or the sacral flexion. And then again, a slow, deep breath in, inhale, exaggerate the sacral extension or counternutation, and then resist the sacral flexion during exhalation. We maintain this for at least 5 to 7 respiratory cycles, and then of course we're going to reassess the symmetry of the landmarks, the motion of the SI joints, as well as checking the standing and seated flexion tests. So bilateral sacral flexion using respiratory assist muscle energy.